Well, good afternoon, everyone, and welcome to another town hall with the Detroit Regional Chamber. My name is Brad Williams, and I am the Vice President of Government Relations at the Detroit Regional Chamber. And our guest today is my friend Kerry Ebersole. And Kerry is wearing, I don't know, Kerry, how many hats are you wearing with the governor's office right now? 3, 4, 5 hats? But
there's at least two.
2 hats. But the reason we asked you to join us today is the hat that you're wearing that's top of mind for all of us right now is leading the charge in getting Michigan vaccinated for the governor right now. So thank you, Kerry, for joining us. We appreciate the time. You know, right now in Detroit, everyone is thinking about what's going on at Ford Field right now. How many shots per day are they rolling through at Ford Field right now?
So in our first week of operation, so we just launched, our soft launch was last Tuesday. So we have completed over 38,000 shots in arms over the last week, which is wonderful. That includes some of the mobile sites that we're also using. So we're loading up shots in vans and getting them out to community locations to deploy shots as well. Yesterday alone, the combination between the mobile sites as well as the on-site at Ford Field, we did about 5,900 doses. So totally ramping up to that 6,000 that FEMA and the Biden administration has piped through the site. So we're putting those to work. And I got to tell you, just because I know we'll probably at some point talk about the race against the variants, but these additional doses that the Biden administration has connected to this FEMA community clinic at Ford Field is just tremendous. Any additional supply we get into the state is just a benefit to all of the work ahead we have to do to get our state vaccinated.
So, Kerry, the other day, I think it was Monday, maybe last Monday, I saw on social media, and I think a lot of other people did, hey, if you're 16 or over, get down to Ford Field. There's other doses. There's extra doses. Get there. There's shots available. And now I've heard reports, you know, don't go down to Ford Field. That we don't want people lining up waiting for extra doses. What's the current advice on that? And, you know, I mean, I guess it's encouraging that everyone kind of wants their dose right now, right? But so what's the state suggesting people do if they want their dose and are hoping for an extra?
Yes, yeah. The best thing is to guarantee yourself a dose at Ford Field is to register and schedule an appointment. That's how you guarantee yourself a dose at Ford Field. But there are times that we are able to accommodate walk-ups, but it's not very often. Last week, when the social media post that you mentioned was kind of a special occurrence that happened as we were getting our feet under ourselves, and we overfilled pre-filled syringes, and we needed to get them in arms in a set period of time. So that's what happened last week. And our recommendation to folks is only go to Ford Field if you have a scheduled appointment, or if you're in the neck of the woods and want to stop by to see if they have any availability to accommodate you, you're welcome to check in. But I don't encourage you to line up.
All right. So talk to people like, you know, we've talked about Ford Field. How is it going in the rest of the state? You know, I am kind of religiously checking. You know, my thing is I go to the New York Times every day, and they've kind of got the map that shows how vaccines are rolling out nationwide. And then I scroll in and see how they're going in Michigan, and it kind of looks like up north they seem to have a little bit higher density of people who've been vaccinated. How's it going in the rest of the state?
Yeah, I would say, you know, largely early on, our biggest challenge with the vaccine was the lack of supply. And I'm sure there's folks maybe listening in right now that felt that and the frustration that came with it. So that was our biggest challenge. And we started rolling out the vaccine work in the middle of December, you know, obviously focus on those healthcare frontline workers. From there, you know, we have gotten our percentage for 65 and above, you know, folks 65 and above is doing pretty well across the state. Any places, like I'll give you an instance. We did a mass clinic with our Michigan National Guard up in Bay, Midland, Saginaw counties to help bolster their 65 and ups, because we did notice that, you know, across the other state averages. So that's the type of detailed data work that we're doing in partnership with the Michigan Department of Health and Human Services to, you know, jump into those problems and really infuse some support, whether that's through the National Guard or, you know, with some of our community partners to get additional doses in. So I would say, and I got to mention, last week, the Michigan Health and Hospital Association issued a release showing the connection between vaccination rates. So obviously those folks that are older in the state of Michigan compared to COVID cases. And guess what? The news is good. The vaccine is working, and keeping those folks out of hospitals, those older folks that have been vaccinated. Without getting too much down a rabbit hole, I think what we are seeing with our cases on the uptick, it's younger folks that are being affected by this disease and the variants that are in the state. And that's why wherever you are and whatever you can do, especially amongst your members, to communicate with both friends, family, and employees or other partners you work with, get vaccinated as soon as you are able to. Please, please, please do that.
So you mentioned the uptick recently in the cases that Kerry, and I think we've all noticed that recently and all have concern about it. But you also mentioned that, you know, certainly a younger population, and we know that, you know, folks like us, it was our parents and grandparents, you know, were the first to get vaccinated, and that's good news because they're the most vulnerable. You know, how do we balance the optimism of a vaccine, you know, that makes us all, you know, more willing to do activities that we weren't willing to do a year ago, with the caution we need to exercise with the uptick in cases?
Yeah, that's a really great question. I think it's a hard one we all face, right? So much of any of our activities is balanced on a spectrum of risk. And we just want to point out, we know what works. The vaccines are working. Okay, the vaccines that are available to us now are an amazing match to the current variants and will protect our loved ones against the most severe impacts of the disease. We know masking helps, we know social distancing helps, and as our vaccination rates go up, I think we got to continually be aware that younger folks, that's what, you know, I got to tell you, it's made national news. The pediatric cases and ICUs in Michigan hospitals are a national story right now. And I got to tell you, I've been hyper focused on this in the last 24 hours because I'm a mother of a 3.5-year-old. But even though we adults may start to be productive, there are still transmission happening with younger folks. And again, those are people under 16 that have yet or don't have vaccine access. And we have to be thoughtful, because that means the virus is going to keep mutating, and it could get farther away from what the current vaccines have been designed to handle. So I know that's kind of, again, another rabbit hole, which I tend to get down. And as a layperson who has been absorbing all information from our state epidemiologist and Dr. Caldoon, who's our chief medical exec, this is why it is really our individual responsibility not only to protect ourselves and our loved ones, but be thoughtful in terms of how we're engaging with other families.
Yeah, I think, you know, what we have all learned in the last year, Kerry, is that there is no rabbit hole that we can't go down. Yes. I mean, I have gone down so many rabbit holes in the last year. I neglected to mention at the top, too, that there is an opportunity for everyone here to ask questions of Kerry. There is a question tab in your GoToWebinar program. Feel free to ask those. I've got that open and am tracking those, and will ask them as appropriate. You mentioned, Kerry, earlier the supply that's available because of our Ford Field Clinic, and certainly the supplies increased considerably. The president mentioned a few weeks back that the supply is to the point where he expects that we're going to have maybe a normal-ish 4th of July. Is that still your expectation? And do you feel like our supply curve in the state is still holding strong at this point?
And getting stronger. So, and I always, again, because it's a reflection of my personal gratefulness to the Biden administration. And one of the first things they did was they worked with the vaccine manufacturers to cut the deal, buy more vaccine, up their production so we could get more vaccine into the states. So that is happening. We're seeing it. The governor just announced this morning. Our new goal is to hit at least 100,000 shots in arms a day. And that is directly related in terms of what we're seeing in our allocation from the feds. You know, we have the number it's escaping me just this minute, but it's over 600,000 doses coming in this week. 147,000 of which are the Johnson & Johnson vaccine, which we haven't seen that level from them in a few weeks. So this is an exciting time. And to get to the question, it is every intention. We are gonna do whatever we can to strive towards that herd immunity by the 4th of July. And it's not just us, right? We need you and are grateful that you are hosting this conversation. And for all the members on the call, again, it's your personal networks, it's also your professional networks, your employees, and everyone else that we need to ensure that they have the information they need to get vaccinated.
So, Kerry, what should employers be doing beyond sharing information? I mean, I can tell you just, you know, from the chamber as my employer, I mean, the chamber's been sharing information about the vaccine. You know, I feel like I know plenty about the vaccine from my employer, but what can employers be doing to encourage the vaccine?
Yeah, that's a great question. So I would say a couple of things. One is, I think that, you know, what I've, you know, heard from employers that, you know, many have been, as you mentioned, sharing information, whether that's through newsletters and emails. And I don't think we should undersell the importance of that, because a lot of folks may be wondering, what is the data? Why is this important? How does it impact me? Those are all normal questions we all ask, and especially over something that's medical. So I think striving to drive those pieces home are important. I think the other thing is the urgency piece. The urgency piece is real. And, you know, you've heard me talk about it a little bit as it relates to the race against the variant, the increase in cases and the transmission rate of the new variants here in state. I think that's another piece. I know, and I don't, I'm always careful because I don't walk in a business shoes. I don't walk in the shoes of business. I do know through conversations, some are thinking through various incentives and to help support employees to make that decision. There's also the idea, and we're ready to support that from the governor as well as Michigan Department of Health and Human Services. If you want to do an on-site clinic, if you have more than 250 employees at a location, we're happy to work with you to set that up. So those are a couple of things that I would mention in terms of what businesses can do.
That's great. We actually had a question about on-site clinics in the question box. So you answered the question before I could even get to it, because that was going to be my next one. I know, Kerry, you know, for example, I personally have been doing some volunteering at the at one of the clinics at Michigan State. And there, what is the future of kind of the large scale clinics? And would that be an opportunity for employers maybe to encourage their employees to do some volunteering at large scale clinics so we can do it at volume? Or do you think in the future, you know, as we get to more reluctant receiving the vaccine, that maybe large scale clinics won't be as abundant?
Listen, I think that you can count on large scale clinics being part of the equation for the next 3 months, certainly. But we also are threading in additional community-based clinics. Again, So I would say a couple of things. Right now, we're very focused on speed. I feel like this is going to definitely be the message that folks will carry with them out of this, because it is a race. It is a race. So we want to, and that's what's nice about those mass clinics is, you know, we can go through thousands of people within a day. You saw the Spectrum clinic at the DeVos place in West Michigan, I think set a national record for a one-day vaccination total, which is amazing and infusing a great piece of protection for the west side of Michigan and those folks, which is great. But at the end of the day, what we know from research, at least, is for vaccine hesitant communities, it's very much about access points and making it as easy and readily as possible for folks to get their vaccine. And I think you mentioned the federal pharmacy program on the onset of this program, and that is true. The Biden administration is pumping a lot of vaccine through some national chains, Rite Aid, Walgreens, CVS, and then our very own Meijer, as well as getting some federal based allocation, which has been tremendous, and the sites that they've supported. So that helps access. Okay, but there's also, we're paying, and a lot of our mobile sites, and we're paying close attention and getting who are the churches we are partnering with, the community-based organizations that have a specific, credible, and known source in various neighborhoods, so folks feel comfortable. They can go there to get information, they can get their vaccine, etc. There's also last year, DHHS did a lot of work setting up testing locations across the state. We expect to, pair those with, providers to not only provide testing resources, but vaccination resources. So it's going to take a combination of things to do what we need to do to vaccinate our state. And I would say this could be another ask, or another way the business community could help, is if you have existing partnerships, or if you're involved in organizations, community-based organizations that serve especially underserved populations or communities of color, that is what has come through in our data that are vaccine hesitant. Let us know. We are always open for advice and wanting to get more vaccine into communities.
So you mentioned specifically, Kerry, a little bit ago about the on-site vaccination clinics for employers, and yes, my question box lit up with people wanting to get more information about how to do that. Can you give us more information on that?
Yes, absolutely. So there's two things that we need to do. And I don't know if maybe the Detroit Chamber could be a resource to collect info from your members of those businesses that are interested in that. We need to know the location and confirming that you have at least 250, or what the number of employees you have on site at a given period of time. Those are the key pieces of information. Now, I do want to highlight, and then you'll send that to me, and then I'll start working my end through MDHHS. Now, the second piece I would advise folks is to also have a conversation with your local health department. I know the mayor and the Detroit health department has been working with employers within the city limits. So if you haven't already had a conversation there, or with County Executive Evans' office, or any of the other health departments in Southeast Michigan, I'd encourage you to do so and know your desire to have an on-site clinic. But let me do the but, because I've had conversations with the business community along the way. I just want to share what some businesses have reflected on when they think through this. And one of those pieces are the question of, do I want to vaccinate my entire workforce on the same day, in case there are, side effects from the vaccine? And that could be fatigue, headaches, that's what we're seeing by and large. But it's just a question mark that businesses have raised to me, and to think through if that's how they want to do it. The other piece too, and this was really, early on when vaccine was limited, our supply was limited. And as we move through the age grouping eligibility, that some of your workforce may have already received the vaccine or have been eligible at an earlier period. So those are just some of the things that have come up when I've had this discussion.
That is great to know. And here's what I will suggest to those of you who have lit up my question box. If you are interested in getting more information on this, how about we start with this? If you want to send an email to members@detroitchamber.com, we will collect your information there, and we will make sure that we get it over to Kerry in her office and make that connection there. And we'll start from there. And I think that's a great starting point. Kerry, you mentioned earlier communities of color, and I know there has been, there's been some survey data and there's been some anecdotal data about reluctancy within communities of color about getting the vaccine. What are we doing to address that? And what should we be doing more to make sure that all of Michigan is getting the benefits of the vaccine?
Yeah, so this is really, especially as supply has increased, we've had high demand, right? That's going to switch here in a few weeks. And to your point, we need to really bolster our work to address hesitancy. And I always like to, yes, we know from research where probably larger numbers of hesitant folks are, these communities of color. But I also say, have we vaccinated 100% of folks 60 and above? No. So let's leave no stone unturned. I want to make sure that we are amping our communications in particular and messengers that connect with those segments of Michiganders. So that's just one example. We just launched an ad this week. There was a lot of confusion, for seniors, especially since they were the first group, on where to go to get a vaccine, how to schedule an appointment. Some, they may not live on our devices like the rest of us. So, threading in 211, explaining how to access. We just launched a TV ad last week directed at those folks that have yet to be vaccinated in that older demographic. But communities of color, listen, at the end of the day, it's personal. Physicians are going to be really strong messengers. It's going to be, folks that are neighbors of people that have had the vaccine, or maybe they were hesitant and they talk about why they were hesitant, how that was addressed. Some of it's just with medical facts. Some of it was, I was more comfortable just getting the 1 dose of Johnson & Johnson versus the 2 doses. Some of it was about access. It's all of those pieces with very localized messengers. It's not going to be me, Kerry from East Lansing, that's going to convince, even though I will try, and I'm happy to talk to anyone. But at the end of the day, that's where we're going. Hyper local folks that can talk about their experience, their ease of access, and what to expect through the process of getting vaccinated. So that's where we're going.
I would trust you even if I didn't already have a shot. You would convince me. I had someone in the chat ask about vaccination if they've already gotten sick. What is the current thinking on that? Is that if you've already had the virus, should you get vaccinated? And I guess this is my curiosity on top of it. If you've already gotten the virus, is there any sort of advantage to maybe waiting till people who have not gotten the virus get vaccinated?
So first and foremost, if you've had COVID, you should still get vaccinated. Okay. Now, double check with your physician or go to our DHHS website to double check timing. Like if there's a waiting period after you got it. I'm not a physician. I don't play one on TV. I just talk about what I know on the data front and what we're trying to do to get folks vaccinated. So that would be my first suggestion, is yes, get vaccinated if you've had COVID, but double check with your physician or our FAQs on the DHHS website.
All right. So next question is, we get a lot of people who are still, kind of, frustrated about not able to get an appointment. I've heard people who are saying, well, I've gone down to Ohio, I could get an appointment in Toledo. Is that okay? Are we I know we're to the point where, what is it, next week we're opening it up to 16 and over with health conditions, and then it's everyone pretty soon. We're kind of to the point though where I think, if you can get an appointment in Toledo, that's cool, right? Just get your appointment and go.
Yeah, so yes. I mean, the short answer is yes. I would say, next week, 16 and above, it's completely open. The governor mentioned, I think it was yesterday, that there are providers in the state, if they have the ability to offer it to anyone 16 and above, they should move forward in doing that. To your point, Brad, depending on where you are in the state, there's different demand for the vaccination at this time. And I know it's been quite challenging because we haven't had a centralized way to register and schedule an appointment. So I like to take that right on the chin. I mean, part of that has to deal with our decentralized public health system and how we've set this up. The other piece of this, obviously, is the federal supply that's coming through in different streams, if you will, into the state. Like the Rite Aids, they have their separate system to register. So it's an imperfect system. So my advice is yes. And I think Dr. Caldoun also says, take the first shot that is made available to you. And if you're stealing Ohio doses, part of that makes me laugh and feel good about, because that means there's more doses that we can allocate around here. But in all seriousness, I would say please continue. If you haven't gotten a vaccination appointment, please continue to register at all available sites, those pharmacies, Meijer, and your local health department. Take the first appointment that's available, and the first vaccine that is available to you. And I know that Cranes has also, I think, compiled a way to look at what's available or where you can register in a site in the state for vaccination appointments. So I would credit them for helping compile some of that. We also offer our DHHS website. If you go on, put your zip code in, that will also pull up a set of information that can help guide you.
Yeah, I think Chad Livengood's Twitter feed has gotten many people appointments who have been struggling to find one. I know he helped a member of my family get an appointment, so it's been very helpful. So that's a good tip I've got.
I think he gave you quote of the day too on Twitter just a little bit ago.
Oh, well, there we go. I didn't even realize I had said something worth quoting. So, Kerry, any last thoughts before we wrap it up? I know we said we'd only take up a half hour of your time, and I feel like that's probably more time than we should have taken, because the work you're doing is so critical. So anything that you'd like to say to us before we let you go back to it?
Yes, I try not to talk with anyone without leaving by giving someone an assignment. So to you and to folks that are listening in, please help us on social media, bolstering information about vaccine importance and awareness. Get your family appointments and make sure your employees have the information they need to get vaccinated. Those are assignments. Newsletters, bolster, help us. We're all in this together. We're going to get through it together. And I really appreciate the time and partnership. So thank you, Brad.
Yeah, and my piece of advice is celebrate when you get your vaccine, and celebrate with someone else when they get their vaccine. Because when someone sees you celebrate, then they're going to want to have their own celebration. So that's been my theory, is to celebrate with everybody. So thank you, Kerry, for your time. Thank you for all the work you're doing. Public service is always important, but this public service is especially important. So on behalf of the chamber and our members, we really appreciate the work that you're doing. Thank you to everyone for joining us. We're looking forward to hosting more of these in the future. Again, if you want more information on an on-site vaccination clinic, send an email to members@detroitchamber.com and we'll get you connected with the right folks. And we'll look forward to seeing you again soon. Thanks so much.